Now, this lesson is going to be focusing on the industrial period. Now, this is one of the periods that people tend to make the most mistakes on when it comes to the mixing them up in terms of cause, treatment and prevention. Now, what this is going to focus on is treatment. How did treatment improve in the years 1700 to 1900? And the three things to describe the roles of Nightingale, Simpson and Lister, to explain how their ideas caused progress, but also look at some of the negatives towards their ideas. That's quite important that you understand that. Because if you get a 16 marker on these individuals, you must talk about the positives and the negatives. We're going to go through each individual, and this will allow you to analyse the most important in your historical opinion. Now, just as a reminder for each group in this period, now remember, this period is 1700 to 1900. So with cause, you've got Dr. Bastian and spontaneous generation, Louis Pasteur and the idea of germ theory, and Robert Koch, his concept of matching germs to certain diseases. For treatment, you've got Florence Nightingale, James Simpson, and Joseph Lister. Now, you can link Louis Pasteur into treatment, but I don't think you'll be able to write a significant amount, because you can link Louis Pasteur to Joseph Lister. You could, to a degree, link Louis Pasteur to Florence Nightingale as well. You'd have to be really sophisticated in how you did that. Then for prevention, you've got Edward Jenner, Edwin Chadwick, John Snow and the Broad Street Pump, and Government and Public Health, 1842 to 1875. It's really important, if you've got a question on treatment, prevention, cause, that you talk about the right things. If you get a question on treatment and you talk about Jenner, instantly there's a paragraph gone, and the examiner would probably, well, the examiner wouldn't even read it. Okay? So it is vitally important that you have that clear understanding on which person and group belongs to which. So, what were hospitals like in the 18th century? Now, I'm just going to go through hospitals because the first person we're going to look at is Florence Nightingale. In this period, there were very few hospitals. So when you got to the year 1700, you had very few hospitals. There were actually only 5 in the country, and it doesn't say where they were, but the place in which they were London. So you had very few hospitals. This was because of Henry VIII's dissolution of the monasteries, dissolving the monasteries in the 1530s, because that's where hospital treatment mainly occurred, or predominantly occurred. In the 18th century, wealthy people began to donate money to open hospitals. Some doctors offered their skills free of charge for these new hospitals. Hospitals became the places where sick were treated rather than the places of rest. Now this here is a big change, because in the Middle Ages especially, they were known as hospitals because of the hospitality that they provided. Nurses were untrained in the 18th century, and because of this, a lot of rich people chose to have surgery and treatment at home. And just to add a bit more about nursing, nursing was a working class job. The nurses were seen as flirts, uncaring, and they just really didn't have that much care about their patients on the whole. So that's what we'll look at with Florence Nightingale shortly. Hospitals were still quite picky with who they treated, which it wasn't an inclusive environment. They were mainly deserving poor people. Now what that means is that they had a job, but they didn't have a massive amount of money, so they couldn't really pay their bills. You had another group of people known as the undeserving poor, who were paupers, and they weren't really welcome in hospitals because they were seen as sort of the lowest in society, and their place was really in places like workhouses. The busier the hospitals became, the dirtier they became. I mean, that's quite obvious in terms of population. If you're not used to something being so busy, actually they're going to become quite dirty and unhygienic. Doctors went from ward to ward without changing their clothes or washing their hands. Now, there is a reason for this. In this period, dirt equaled experience. Blood equaled experience. So if you turned up with a really bloody apron on, then people would be like, oh, they're quite experienced. I feel safe with this individual. So how did hospitals begin to change? Now we need to look at the story of Florence Nightingale in two stages. The first stage is Florence Nightingale, the Crimean War period. I'm just going to go through this, even though that title's overly big. I'm going to go through parts of this. It's, again, you can talk about this in an exam question. I think the key thing here is understanding how this period triggered change in Britain and what Florence Nightingale did in the Crimean War to be able to cause change when she came back to Britain. So in the industrial period, there were many more hospitals, as we mentioned, but conditions were very poor, as we said. It was in these dirty hospitals that Nightingale found herself where she began nursing. Nightingale was born into a wealthy family in 1820, and when she was 17, she experienced a religious vision saying that it was her mission to serve mankind. She convinced her parents to allow her to train as a nurse in Germany, Paris, and then she became superintendent of nurses at King's College Hospital in London. So she had experience. This is sort of her background here. But before becoming a nurse at King's College Hospital superintendent, in 1843, Britain went to war with Russia in the Crimea. News reports said that hospitals were not fit for the soldiers, and there was a national outcry that there were no nurses or even bandages. Enter Florence Nightingale. Because of the outcry, Nightingale was able to convince the government to send her to improve the hospitals along with 38 other nurses. She had a real positive reputation. The government sent her, which would have cost quite a lot of money. When Nightingale was in the Crimea, she made changes for the care of the wounded soldiers. So what did she do? Well, very simply, if I'm going to sum it up in one word, I'll put it here. She focused on cleanliness. She focused on the actual environment in which the soldiers were in. So these are some of the things that Nightingale did. She demanded 300 scrubbing brushes to get rid of any dirt near patients being treated. This would allow them to prevent infection, and again, a concept that wasn't, massively known about yet, because remember, if we're in 1843, we don't know about germ theory yet. Nurses were organised to treat 2,000 wounded soldiers, so the nurses would triage the most serious cases, clean bedding and good meals. Now, it seems really simple, these 3 points here, but the thing that Nightingale did was lower the mortality rate, the death rate. And within 6 months of her and her nurses being there, it dropped from 40% down to 2%. So by the time Nightingale returned to Britain in 1856, she was a national hero. There was a great deal of bad publicity about the conditions in war hospitals, and Nightingale was famous for making a big difference. It gave her credibility and helped her to make changes for hospitals in Britain. So that's the background. That's Nightingale, the background, how she developed this reputation as a hero. But what did she do that made the changes in Britain so wide? I'm going to go through some of these things here, and your job will be to explain. So if you've got the treatment question for GCSE, you've got the evidence here, your job is then to explain why that caused change. So Nightingale set up a nursing school at St Thomas Hospital in London called the Nightingale School for Nurses. She raised £44,000 of her own money to do this. Why is that going to cause such a big change? Well, having a training school means that new nurses are going to learn the methods of Nightingale, which is important. Hope if I spell Nightingale right. It allows consistency across the profession, which again is important as it allows safer, more accessible care for all. So this here is quite vital, okay? This point here is really important to understand just how much change a school, Nightingale School for Nurses was, all right? And this in itself allows people to be drawn into the profession. So I'm just going to add something else here. It encourages more middle class women to join the job, which again was important because not many middle class women saw the value in becoming a nurse. So it encourages more middle class women to join the job. It's seen as a more respectable career option, which again would have been really important. The next one, Nightingale did not teach about germ theory. She believed disease was caused from miasma. She focused on keeping hospitals clean, ensured doctors did not mention germ theory around nurses. Well, basically what this does is it keeps Nightingale's beliefs and, well, which were very successful, at the forefront of her care. Again, it's important. I wouldn't go on too much about that in the exam. Training turned nursing into a profession rather than a simple, unskilled job. It's seen as a lot more respectable, which in turn, as I've mentioned above, it's going to encourage better candidates, which in turn may encourage more people to go to hospital for treatment. All right, again, that's important. It gives that explanation about why there was progress. Promoted pavilion-style hospitals. Now that's a key word there, pavilion-style hospitals, where separate wards were built in hospitals to ensure infectious patients could be separate. Cross-infection is going to be reduced. Less threat towards the patients. Keeping patients separated means that there can be specialist nurses who can effectively deal with a range of people with the same problem. Not just this as well, but these pavilion-style hospitals were made out of material that was easy to clean, which links back to Nightingale's aspect on cleanliness, which is really important. Nursing was seen as a respectable occupation. Nightingale nurses came from middle-class background, whereas before they came from working class and had a reputation for being flirts, drunks, and uncaring. More people get involved. Okay, it's very repetitive, but it does help. More people will get involved. It's seen as a respectable career. It means that more people begin to trust hospitals, which is going to lead to growth and development, which it can do at this stage. Cleanliness became important due to Nightingale nurses. And because of this, it means that in the long run, there's going to be less deaths, hopefully, due to infection. Nightingale wrote Notes for Nursing in 1859, setting out key role of a nurse and importance of thorough training. Well, this is basically just like the guide to nursing. Not just this, it's Nightingale's guide. So when she is gone, people can pass down the skills that she taught to make an effective and successful nurse. Okay? So all these ideas here are absolutely pivotal in the idea of why Nightingale was able to change hospitals, why Nightingale was able to change nursing. There was an overview. Just going to quickly show this, the achievements of Florence Nightingale. So how could you develop this? This is a good revision activity to go from that evidence and that explanation that we just had to overall achievements. So helping soldiers in the Crimea, 300 scrubbing brushes, clean bedding, etc. Emphasis on sanitation, ventilation, and the right food. Setting up a nursing school in Britain, the Nightingale School for Nurses. He trained midwives, which meant that, babies were going to be born with less complications. It means that people could have support through their pregnancy process. He redesigned hospitals, pavilion style, separate wards, less cross-infection. They were made using materials that could be cleaned a lot easier. Turned nursing into a respectable profession, not seen as a working class low job anymore. And sanitation was key to her focus. He realised that nurses were absolutely vital to this, and they could complement the work of the doctors. Doctors treated, nurses sort of ensured that there was an element of comfort, nurses ensured there was an element of care. Nurses could make sure that obviously within the when there isn't a doctor around, that they are the first point of call for any patient, which gives them an element of trust, which has grown over time. So how did hospitals develop by 1900? So we mentioned earlier about what hospitals were like in the 18th century. What were they like by 1900? Infectious patients were split up between infectious people and those needing surgery. So it was more effective in how it was broken down. And if you look at hospitals today, they're very pavilion style in terms of having different wards for different problems. Operating theatres and specialist departments providing spaces for certain operations was really important. Cleanliness was the most vital thing. Hospitals focused on cleaning up germs using antiseptics, and then changed focus to try and prevent them from getting in using aseptic methods. Now, we're going to look at this in a minute when we look at Joseph Lister. Doctors were a much more common sight. Trained nurses live in nearby houses, which actually they still do in today's society, provided for them so they were near to hospital. Hospitals attracted big donations to modernise to a pavilion-style hospital, and the function of the hospital had changed hugely. That's the next problem we have. So going back, the next problem we have is in surgery. And Nightingale dealt with the hospitals. Simpson and Lister deal with surgery. So what problems do we actually have in surgery? Three of the biggest issues were bleeding, pain, and infection. Okay, any problem that you would face. Surgery was very different 1700 to 1900 than what it is today. But it's because of this period that we have the advancements that we have in today's surgical world. Substances such as opium had been used to calm patients, but without anaesthetic, there was no way of preventing the pain. People were having operations while they were awake. Surgery had to be performed very quickly. Now, in terms of this, I mean, the quicker, the better. Why? Well, number one, the patient might bleed to death. They might go into shock and go into cardiac arrest. Even if the operation was successful, infection was still a big problem. Areas weren't germ-free. Surgeries mainly happened at people's homes, mainly the rich, and the surgeon wore the same clothes. As mentioned previously, the muddier the clothes, the more sign of experience. Dressers would hold your patient down, which would cause more stress, which could cause the surgeon to cut a main artery if they were doing an amputation. Surgery was limited because the main surgery that did happen in the industrial period was amputation. Other types were rare because the more that the person was being operated on, the higher chance of the patient bleeding to death. So we're going to look at both how pain and infection were dealt with. Obviously, bleeding is very difficult, and that's something that we look at later on when we look at blood transfusions. But problem number one was pain. So we need to look at Simpson and chloroform. So anaesthetic was used. Now, anaesthetic, if you're not sure what it is, anaesthetic puts you to sleep before an operation. And that had been used before the use of chloroform with varying success. In 1795, Davy inhaled laughing gas and discovered it numbed pain from nitrous oxide. In 1842, Clark used ether to remove a patient's tooth. So they were put to sleep to remove a tooth, and it worked. And then in 1846, Liston, don't mix it up with Lister, Liston anaesthetised a patient using ether and amputated their leg. But be aware, ether made patients vomit, and it was highly flammable, which was a problem when you did surgery by candlelight in the industrial period. So where does James Simpson come into this whole concept? James Simpson, he was a young surgeon from Edinburgh, and he was convinced there were better anaesthetics to treat patients. As we said, laughing gas made people vomit, and ether was flammable, and that was difficult when operations were done by candle. So Simpson gathered a group of his friends to inhale vapours of various chemicals to see what may work. The entire group were found the next day passed out by Mrs. Simpson. Next to the party was an empty bottle of chloroform. Simpson then linked chloroform as a possible effective anaesthetic to replace old methods. The only problem, or the only job that Simpson now had, was to prove it and gain support for it. Now, there were both positives and negatives to chloroform and Simpson. So here's just an overview table on how each of them are viewed. So we'll look at the negatives first. Chloroform had to be controlled carefully or an overdose could occur. The chemical also affected the heart, it was proven later on, which caused fit and healthy people to die when they were being operated on. The first recorded case of a chloroform overdose was a girl called Hannah Greener, a 14-year-old girl who was just having an operation on an infected toenail. Because of the level of chloroform she was given, she died of an overdose. Chloroform did remove pain, but infection was still a big problem as the patient was being operated on for longer. More people died in the short term due to infection than what they did before chloroform had been introduced. Well, that's highly problematic. It's something that caused a lot of negative in regards to chloroform usage. Some doctors believe the patient had more chance of dying if they were asleep, so they believe the screaming and the pain kept people alive. And because of bleeding couldn't be controlled as much as the patients were bleeding. The positives of chloroform. Chloroform was used as an effective way to administer pain relief. And the turning point for chloroform came in 1853 when Queen Victoria used it to give birth to her son. She described afterwards the whole process as being quite soothing and calming, and the fact that the Queen came out with such a positive review of chloroform gave chloroform instant credibility. Simpson was knighted for his, not her. Let's get rid of that straight away. Excuse the overly poor writing there. Was knighted for his service to medicine. Surgeries could become longer and more complex, but as we've mentioned, that could be a problem because of infection and because of blood loss. And it helped replace the use of dangerous other issues such as ether and laughing gas. So was chloroform a turning point? It was. Did it bring negatives? Absolutely. And it wasn't until later on when we started to develop dosages of anaesthetics, and we had an anaesthetist as a job within the National Health Service, where it could become more effective and more measured based on the person, the age, their height, their weight. So that's Simpson, that's chloroform. Problem number 2 was infection. Now, even though Simpson had developed this, infection was still rife. Now, what you must understand before I start going on about this point here is that by 1861, germ theory had been created by Pasteur, and this helped with some justification of Lister's idea. So although Simpson allowed for surgery to happen for longer, infection was still a problem. Now in 1865, Lister operated on a boy with a broken leg who had been, I believe, he'd been run over by a carriage, and he wrapped it in carbolic acid, which it was previously used in the sewers to clean them. Now, this was rare because this type of break that the boy had, I believe it was a femur break, healed, which was rare, as many people died of infection following such a serious operation. Following this, Lister took steps to prevent infection during surgery, including spraying carbolic acid in the air. Now, Lister didn't really know how this works because germ theory was a relatively new concept. He couldn't explain it, which led to problems. What we need to understand about carbolic acid is Lister's idea led way to future ideas on cleanliness in surgery. It must be understood, but by 1890, carbolic acid or carbolic spray was not being used, even by Lister. But it did pave the way for aseptic conditions in surgery. But Obviously, we'll look at the process because it is still very important. Now, when Lister found that carbolic spray worked, he published his ideas in the Lancet, which was a medical journal, which a lot of key individuals did this. He detailed 11 different cases in which carbolic acid was successful. So he seemed to have a breakaway idea on how it would help less people sort of die in terms of infection after an operation. But the most important change was not the development of carbolic acid. Lister's idea got people's attitudes changing, and it led to aseptic surgery. Surgeons were more aware of how to keep surgery germ-free by cleaning equipment, wearing rubber gloves, clean gowns, and wearing masks during surgery. This is still used today, and if you ever watch, some of the medical programs that are on telly, you'll see that people wear masks when they go into an operating theatre, and in general, that would have a massive impact, making sure that germs don't spread during these operations. So, like Simpson, how did Lister cause change in treatment of disease? Now, the green statements here are positive and the red are negative. So I'm just going to go through the positive ones first. Percentage of people dying from infection went from around 40% to 4%. Now, was this because of carbolic acid? I'm not sure. What it was down to was a change in attitudes. More people, or more surgeons, if I'm going to be more specific, were being aseptic in their approach to operations, which means germs not getting into the operating theatre. Carbolic acid began the change in attitude, which is important, okay? And that's something you can definitely consider when writing this response. Lister stopped using carbolic acid in 1890. It was a good short-term fix for a long-term development in attitudes. That very much links to this point here. Lister's finding developed the belief in modern medicine that people must wash their hands to prevent the spread of germs within surgery. Again, if you watch any of the programs that are on telly, you might hear of a phrase where people, before an operation, scrub in. And that means they wash their hands, and they have to wash their hands for quite a prolonged amount of time to make sure that no germs are brought into the operating theatre. And due to Lister's use of carbolic acid, it changed attitudes to aseptic surgical conditions, including clean gowns and sterile equipment. So gone were the days of surgeons wearing bloody gowns into an operating theatre. Now, the negatives of Lister: his ideas spread quicker than germ theory. However, this meant because Lister's ideas were put in place before germ theory was fully accepted, Lister couldn't really link the two ideas together. So it was hard to explain, which means some people didn't really respect the concept. And as a result of this next one here, Lister just told people to use carbolic acid without really explaining. He was a doer rather than a thinker. You must do this. Why? I'm not sure. Many surgeons refused to use it as it dried out their hands, and they were worried that the impact it was having on their patient, who would have been asleep due to the development of anaesthetics. And it was very difficult to prove antiseptics, as some people believed germ theory was fake, such as John Bennett, who believed in cell death. So until the concept of the germ theory became more accepted around sort of 1878 onwards, the concept of this infection was going to be very hit and miss. But on the whole, Lister did cause quite a significant change in people's attitudes in what an operation should be like. So this should very much help with a 12 marker on why there was progress in the years 1700 to 1900. But just remember, there were also some key negatives, and to evaluate the most important is quite difficult because there were links, and it very much depends on the time in which they were. So, for example, when Lister was around, he had some backup with germ theory, whereas Nightingale at the start of her career didn't have that. But likewise with Simpson, there were a lot of negatives to his chloroform, but they did have aspects of positivity. But wasn't this because of, for example, the role of the Queen in this? It's something that you must determine, obviously, in a question. If it was a 16 marker, not just at least know positives and negatives. Like, for example, you could argue to an extent Nightingale very much distanced nurses from the doctors, which could cause problems. But it's Nightingale is very difficult to drag negatives out of. As I say, those are the three people, and this is everything you'll need to know for industrial treatment in the year 1700 to 1900.